So good morning, everyone. Now we'll be discussing about the public health agencies. So these public health agencies they work together to prevent and control the epidemics through reporting the communicable diseases that is happening in our country or the whole world. They also educate the people about the how is these diseases transmit to another and how to properly sanitize ourselves. They also identify if how the infection spread or what is its sources. When an individual is sick, they isolate them and conduct an immunization program and provide treatment. So through this, they can eradicate the and eliminate the disease like smallpox and polio in many regions. One of the public health agencies is the WHO or the World Health Organization. So the WHO is was established in 1948 as a UN agency. Uh, they aims to promote global health cooperation, control and eradicate diseases, and enhance the human life quality. So during outbreaks like the 2000 Ebola crisis in Uganda, WHO or the World Health Organization, they sent teams of epidemiologists to investigate and assist in containment. So they send groups to assist these epidemics. So the notable successes include the eradication of smallpox in 1980 and ongoing efforts to eliminate diseases like polio, genital worm infection, leprosy, neonatal tetanus, and Chagas disease. So there are many diseases that they eliminate. And the WHO is or the World Health Organization is currently focused on eradicating polio with significant progress in the Western Hemisphere. So currently we are facing these polio diseases which are the World Health Organization is focused on. Next is the CDC or the Centers for Disease Control and Prevention. So this is a crucial agency under the U.S. Department of Health and Human Services. So based in Atlanta, Georgia, it plays a pivotal role in monitoring and controlling diseases both within the United States and internationally. So at the CDC or the Centers for Disease Control and Prevention, uh, microbiologists work in secure labs. They handle dangerous pathogens to better understand them and develop treatments or vaccines. Meanwhile, uh, the epidemiologists are out in the field. They are investigating diseases, outbreaks, and working to contain them. So, one of the CDC's important tasks is preparing for emergencies, including potential bioterrorism threats. So to be ready for such situations, they stockpile vaccines. So like the smallpox vaccine which can be quickly deployed to protect the public in case of an outbreak. We have a table here that shows the definitions of epidemiologic terms relating to infectious diseases. So first is the control of an infectious disease, meaning ongoing operations or programs aimed at reducing the incidence or prevalence of that disease. So next is the elimination of an infectious disease, meaning the reduction of case transmission to a predetermined very low level, example to a level below 1 case per million population. And next is the eradication of an infectious disease, meaning achieving a status where no further cases of that disease occur anywhere and where continued control measures are unnecessary. So this is a table 11 to 6. the World Health Organization's definitions of epidemiologic terms relating to infectious diseases. So the CDC was established as the Communicable Disease Center. So they originally focused on diseases like malaria and typhus. So over time, its scope has expanded to include rather various health-related aspects. So with a mission to collaborate and provide expertise, information, and tools for health protection. The CDC now comprises multiple offices, centers, and institutes. One key center, the Coordinating Center for Infectious Disease, oversees four national centers. So the CDC has a four national centers overseas. So the first center is the National Center for Immunization and Respiratory Diseases. So, the National Center for Immunization and Respiratory Diseases, it is a division of the Centers for Disease Control and Prevention or the CDC that focused on preventing illness and death through immunization and control of respiratory diseases. So, this center oversee vaccination programs. They also conduct research, provide guidance on disease prevention, monitor disease trends, and promote public health education. The next center is the National Center for Zoonotic, Vector-borne, and Enteric Diseases. So it is another division of the Centers for Disease Control and Prevention. So this center focuses on diseases that can be transmitted between animals and humans, or the zoonotic diseases. This center the enteric diseases, the zoonotic diseases. So, diseases spread by vectors like mosquitoes and ticks, and enteric diseases, which affect the intestinal tract. So, NCZVED, or the National Center for Zoonotic Vector-borne and Enteric Diseases, conducts research, surveillance, and prevention efforts to control these diseases and protect the public health. Another center is the National Center for HIV or AIDS, viral hepatitis, STD or sexually transmitted diseases, and TB prevention. It is a division of the Centers for Disease Control and Prevention. So this center, it is dedicated to preventing and controlling HIV and AIDS, viral hepatitis, sexually transmitted diseases or STDs, and tuberculosis or the TB in the United States. So the National Center of these for HIV/AIDS, viral hepatitis, STD, and TB prevention, they conduct research, provides guidance on prevention strategies, promotes testing and treatment, and supports public health efforts to reduce the burden of these diseases. So, the last division of the Centers for Disease Control and Prevention is the National Center for Preparedness, Detection, and Control of Infectious Diseases. So, this center focuses on enhancing the nation's ability to prepare for, detect, and respond to infectious disease threats. So, this national center it conducts research, provides guidance on preparedness and response measures, supports public health laboratories, and collaborates with domestic and international partners to prevent and control the infectious diseases. So, the fourth branch of the Centers for Disease Control and Prevention is the National Center for Preparedness, Detection, and Control of Infectious Disease. So, this branch of the Centers for Disease Control and Prevention is it specializes in preparing for, identifying, and managing infectious disease outbreaks. So its focus is to research, surveillance, response planning, and collaboration with other agencies to protect public health from infectious threats. So again, these are the four branches or divisions of the Centers for Disease Control and Prevention. We have another table here that shows the 10 of the most common nationally notifiable infectious diseases in the United States. So the disease genital chlamydia infections, which is ranked by 1, and the number of US cases reported is um, 1,108,374. So these are the number of cases of the genital chlamydia infectious in the United States. So the second disease, which is ranked with 2, is the cases are 355,000 rather and 991. So these are the reported cases in the United States of the gonorrhea. The third one is the salmonellosis, which has a reported cases of 47,995. Next is the fourth one is the syphilis in all stages. The reported cases are 40,920. The ranked 5 is the chickenpox, which has a reported cases of 40,146. Next is the AIDS, rank 6, reported cases 37,503. Other one, the rank 7 is the Lyme disease, which has a 27,444. The rank 8 is the shigellosis that has a 19,758 reported cases. And then the ninth ranked is the giardiasis, which has also a 19,417 reported cases. And the last one, the last rank, the rank 10 is the tuberculosis, which has a 13,299 reported cases in the United States. The CDC or the CDC or the Centers for Disease and Control and Prevention publishes a weekly report called the Morbidity and Mortality Weekly Report or the MMWR. It provides a timely updates on the infectious disease outbreaks in the United States and globally. So this also includes cumulative statistics on nationally notifiable infectious diseases for the current year. So the health science students are encouraged to read MMWR to stay informed about the public health issues. So this report is you can access it on this website that was provided below. So, through the efforts and the collaboration of these public health agencies, many diseases are no longer endemic in the United States. So, some of the diseases that no longer pose a serious threat to US or the United States communities include the cholera, diphtheria, malaria, polio, smallpox, and typhoid fever. So, the efforts and collaborations are really important. Um, and working with the other physicians, nurses, and other healthcare professionals in the community, even the educators and the community leaders. The prevention and control of epidemics is a never-ending community goal. So, for it to be effective, it must include measures to increase host resistance through the development and administration of vaccines that include active immunity and maintain it in susceptible persons. So, next is ensure that persons who have been exposed to a pathogen are protected against this disease. For example, through injections of gamma globulin or antisera. Segregate, isolate, and treat those who have contracted a contagious infection to prevent the spread of pathogens to others. And lastly, identify and manage potential sources and carriers of infectious diseases by preventing healthy carriers from working in places where they can transmit pathogens and implementing sanitation measures to control diseases spread through water, sewage, and food. So that's all for my part. Thank you.